If you're turning 65 or you're trying to make sense of Medicare right now, this is a comparison most people get stuck on. Medicare Advantage or Medigap. Both options work, but they work in completely different ways. I'm going to break this down in a clear, practical way so you know which one actually fits your situation. No hype, no scare tactics, only the facts you need to make a confident choice. If you like learning how Medicare really works, make sure to subscribe. And if you want my simple Medicare starter kit to follow along with, the link is in the description. Here's the simplest way to think about Medicare Advantage. One insurance company bundles your hospital, doctor, and drug coverage into one plan. You agree to follow their network and their rules in exchange for low monthly premiums. When you go to the doctor or have a test, you pay set copays along the way. There is an annual out-of-pocket max that protects you from worst-case bills. Some plans have strong networks and great benefits, some don't. This is where I see people get confused because the ads make everything sound universal. It isn't. Every plan works differently. Now that you see how Advantage works, it helps to understand Medigap in comparison because the two options are built differently. Medigap works alongside Original Medicare. Instead of replacing Medicare, it fills in the gaps. You can see any doctor who accepts Medicare nationwide. Your monthly premium is higher, but when you get care, your costs stay predictable. Most people choose Medigap because they want the freedom to see any specialist without referrals, or they travel. Others choose it because their health is unpredictable and they want stable costs. One of the biggest misunderstandings is thinking Medigap and Advantage offer the same experience. They don't. And I say this with protective empathy because I talked to so many people who were surprised by network rules or referrals they didn't expect. Here's where Medicare Advantage works well. Premiums are usually low. Many plans include dental, vision, hearing, and gym benefits. Care is coordinated inside your local network, which some people prefer because everything feels organized. And during the annual enrollment period, you have options to switch plans or carriers if your needs change. I'll be honest, some Advantage plans are strong when your doctors are in network and your medications line up. The key is making sure you're in the right plan. The wrong match is where people run into issues. Medigap is strongest when you want simplicity. You get nationwide access to any provider who accepts Medicare. You don't deal with referrals. You don't worry about out-of-network charges. And your costs are predictable, especially if you're managing conditions or seeing specialists often. This is where I add a quick personal note. I've helped a lot of people who felt overwhelmed with networks or referral steps on Advantage plans. When they switched to Medigap, the whole process felt more straightforward. It doesn't mean Advantage is wrong. It means knowing your lifestyle, your health, and how often you use care helps you decide which one fits you better. Medicare Advantage fits best when your doctors and hospitals are in the plan's network. That's always the first thing I look at because the plan only works well when your providers participate. Your medications also need to line up with the plan's formulary. When the drug list matches, your costs stay more predictable. Advantage also works for people who prefer a managed care structure. Everything runs through one company, one card, and one set of rules. Some people like that because it keeps their care coordinated. And the lower monthly premium is appealing when you're trying to keep expenses down. Just make sure your doctors are actually in the plan's network before you enroll. That's the most common issue I see. But when your doctors are in network, your medications fit the plan, and you're comfortable with the structure, Advantage can work very well. Medigap fits best when flexibility matters. If you travel, live in 2 locations during the year, or you prefer choosing your own providers, Medigap keeps everything simple. You can see any doctor who accepts Medicare nationwide, and you don't deal with referrals or network restrictions. Your monthly premium is higher, but when you use care, your costs stay consistent. That's what makes Medigap strong for people who see specialists often or manage ongoing conditions. You avoid unexpected copays and billing issues that come with network limitations. Here's a real example. I worked with someone who split their time between Florida and Georgia. Their Advantage plan worked fine in Florida, but every specialist they needed in Georgia was out of network. Switching to Medigap fixed that problem immediately. If you want consistent access to doctors, predictable costs, and you can afford a higher premium, Medigap is usually the better fit. Choosing between Medicare Advantage and Medigap comes down to a few practical steps. Start with your doctors. Make a simple list of the providers you see now and the ones you rely on the most. That alone tells you which option will fit better. Next, review your medications. Your drug list can change the entire picture and is one of the easiest ways to compare plans. After that, think about your travel patterns or whether you live in more than one location during the year. That makes a bigger difference than people expect. Then look at your budget. Here's how I explain it. Medicare Advantage is pay as you go. You have lower monthly premiums, but you pay copays every time you use care. Medigap is pay up front. You have a higher monthly premium, but most of your costs are covered when you need care. Your personal situation decides which approach works better for you. There isn't a perfect plan for everyone. There's a plan that fits how you live, how you get care, and how you want your Medicare to work for you. If this helped you understand Medicare a little better, subscribe or share this video with someone who needs it. And I'll see you on the next one.